Probably not. But close, it's the same idea.
And you know, like, a lot of people that are drowning can't say anything because they're so scared.
Because they're drowning.
Because they're drowning.
Right.
So you can't
Well,
say
most people in a medical emergency can't say anything. Most people can't say, I'm having a medical emergency, please get me help. Most people can't. Okay, cardiovascular drugs. Oh, there we go. Okay, so cardiovascular disease refers to these different things. So it can be a bunch. Cardiovascular disease in of itself is this huge wide range of all kinds of things. Similar to like an autoimmune disease can be a bunch of different things. It is not just always one thing. So cardiovascular is hypertension, which is what? What do we call that? It's another name for it. High blood pressure. Hypertension and high blood pressure are the same thing. Angina pectoris, coronary artery disease, arrhythmias. Do you guys know what arrhythmias are? It's just a difference in heartbeat. The heart is not beating as it should. It's either too slow or too fast. And heart failure, the heart's not working at all, it's dying. Okay, so some of the things that we're gonna go over, the angina pectoris is a fancy name for chest pain. It means it hurts in your heart, hurts in your chest. And we'll get into it a little bit more. Congestive heart failure, and this later on is also referred to just heart failure. So congestive heart failure, same thing. And then anticoagulant therapy, what's that? It's an anticoagulant. You guys know coagulant, what is it? Seriously, you really don't know, or you're just being quiet? Huh?
Like blood clotting.
Yes, thank you. So anticoagulant means it's going to thin your blood.
I thought you meant like what type, like
Oh,
anticoagulant.
gotcha. No, it just means anticoagulant means it's going to thin your blood. Okay. So can you name a medication that thins your blood? Good. Yep, warfarin, Coumadin, those ones we'll get into. High cholesterol treatment, and then hypertension, which is also high blood pressure. Good. Okay, so this is just a statistic. You guys don't have to know it for the test. But 720,000 Americans suffer heart attacks each year. I actually kind of feel like that's low. On the low end? I mean, I don't know. I feel like it's kind of low. So make sure you know if your patient has had a heart attack within the last 3 months, consultation with a cardiologist prior to treatment is necessary. Okay, so we're going to talk about a heart attack, which is also an MI or myocardial infarction. It just means that there's the tissue damage or it actually dies during a heart attack. So angina pectoris or chest pain, this is usually it's in the left side. Okay, it's usually in the left arm. It starts in the chest and it can radiate to the left arm, to the shoulder, sometimes even to the jaw. People will sometimes have jaw pain associated with this. The reason why it's hurting is the arteries are not supplying enough blood to the tissues and to the heart. Usually it's a lot of times, like in a panic attack, you can get angina pectoris. You can get it when you're exercising really heavy. I've been trying to run more, and I remember one time I'm like, okay, my chest is hurting. I'm like, I'm having angina pectoris. Like, just relax, I'll be fine. And I was. But like, if it starts hurting, you automatically start to kind of panic a little bit, which can lead, because it's stress induced, it can lead to it hurting worse. It can be a precursor to a heart attack, but it's not always. So some people who are diagnosed with this and have had it before, they know whatever they're doing has caused them stress. They need to relax. They need to stop exercising, whatever it is, and it goes away. So some people know that they have this and they know to just calm down and it'll go away. They don't automatically go to the ER. But I'm sure a lot of patients go to the ER with this thinking it's a heart attack and it's not. Happening nitroglycerin is what we want to do. Where do we give nitroglycerin? Sublingual, good. Do we have it in our medic kit? Yes, we do. A lot of people that have angina pectoris are going to carry nitroglycerin with them. So you can ask them where, like at the beginning of an appointment, if they have this, then say, do you carry nitroglycerin with you? And that's not a bad thing to say. Ask if they say yes, say, where is it? Ask them, like, is it someplace that I can get to it if you need it by chance? It's not. It's same thing as like an asthma inhaler. Same idea. You want to know where it is. So is what the nitroglycerin is doing is it's going to open the blood vessels so that more blood can get to the heart, which then will decrease the pain in there. And it's just like, this is important. It's not healing it. It's just helping it until the problem can be fixed. So if you have angina pectoris on a regular basis, you're going to take the nitroglycerin and go to the doctor and see what's causing it. So congestive heart failure. Glucosides are the main family of drugs that are going to treat heart failure. And is what the drugs do is they increase the force and strength of the heart contractions. So just think of, I don't know how to not be morbid about it. I mean, I was thinking like an animal that's dying. It's not gonna, what's mean, huh? Think of a mountain lion that's dying instead of your cat or your dog, that it's not going to be able to attack you as easy as if it's about ready to die, right? So if your heart is slowly dying, it's not as powerful in being able to pump that blood as well. So you take these cardiac glucosides that is going to help strengthen that pumping action of your heart. Really common ones, digitalis and lanoxin, or digiton, or That's hard. Thanks. So in this case, so say they have congestive heart failure and they're taking one of these medications, you want to be careful using a vasoconstrictor, because then that's why they have congestive heart failure, because the blood is not getting, those vessels are smaller. So if you give them, if they're taking medication to open them so that they're healthy, and then you give them a vasoconstrictor to constrict them, you could cause some problems, okay? 5.1 million Americans have symptoms of heart failure. That's a lot to me. That seems high. So anticoagulant therapy. So this is like warfarin is a big, Coumadin and warfarin. Down here you can see our examples. People who have a stroke or heart attack or blood clots are going to take these. An embolism, that is a fancy word for blood clot.
You said stroke.
Stroke, heart attack, and clots. So elderly people tend to get blood clots in their legs. Those blood clots can dislodge, travel to their heart, to their lungs, or to their head. Travels to their head, it's going to be a stroke. If it travels to your lungs, you die pretty instantly. Same thing with your heart. So what is there a risk if a patient is taking anticoagulant? Yeah.
I have a question. Is that why, like, usually for older people, they like recommend you take like a baby aspirin?
Yep. So a couple of reasons. Either your blood is getting thicker naturally as you get older, or as you get older, those blood vessels are also a little smaller because there's plaque inside of them, or they're just not as strong. I mean, those muscles, the vessel walls are not as strong, the muscles in them, so they're not pumping as easy. So the thinner the blood, the easier it's going to flow through. But yes, that's why. So why do we care if a patient is taking warfarin or Coumadin? What does it matter in dental? Okay, what's something that we are going to do that could cause more bleeding that's going to get out of control?
If blood clot travels to the heart, is that a sure way to die?
Yep. Yep, absolutely. Are you plotting something there? Okay, so it's how Coumadin works is it prevents the formation of vitamin K. So vitamin K is vital in the formation of a clot. It's just preventing that. Coumadin also can, antibiotics can increase the effect of Coumadin. So if they're taking Coumadin and then you prescribe an antibiotic for an infection or for, periodontal issues, that's something to consider as well. Plavix is another very popular one that you guys will come across. Heparin is only administered in the hospitals. It's administered IV. So you need to know the Coumadin, warfarin, and the Plavix. Those are the main ones that you'll need to know.
I have one friend today.
Your patient had warfarin today? Yeah. It's a pretty common one. Okay, so cholesterol. So high cholesterol, these are anti-hyperlipidemics. These are all these lipid growths in here. Inside, so this is a blood vessel. You can see it's cut in half, and then this right here is the cholesterol, the lipids that's growing in there, which is basically fat, okay? All of these drugs, high cholesterol meds, are considered statin drugs. So on the test review where it says know the prefixes and suffixes, this is what I'm talking about. Know the statin drugs, what statin drugs are for. And they just control the amount of buildup that is in there. Another thing is if you have high cholesterol or there high cholesterol in your veins, you're going to put on a stricter diet, less fatties. So Lipitor is a very common one. Zocor, Simvastatin, that one I think I've even seen today. Crestor, Lovastatin, all of those are very common. Anything with a statin behind it is a cholesterol medication. Okay, so hypertension, or the silent killer. There's a lot of different drugs that can be used to treat hypertension, including diuretics, the beta blockers, calcium channel blockers, or the ACE inhibitors. So these ones, it's not like where the high cholesterol, it's all the statin. These ones, there's a lot of different kinds that can treat it. Blood pressure, this is from the CDC as well. So 1 in 3 Americans have high blood pressure. So there's 10 of us in here, 3 of us have high blood pressure. I'm one of them, for sure. It's very genetic for me. Both of my parents, my dad is overweight and sits around and doesn't exercise and eats like crap. My mom never sits and eats pretty healthy, and she's the one with high blood pressure. Doesn't make any sense. Sometimes you associate being overweight and sedentary with high blood pressure a lot of times, but it's not always that case. And my mom has been on high blood pressure meds since she's been about 40. And I'm probably should be on them. Mine's that high, or I probably should be. So I think it's just genetic. It's a very genetic linked thing. So how do we decrease the pressure in your veins? So picture that other with the high cholesterol. Picture how much smaller the lumen, or the area, is in your blood vessel for the blood to go through. It's much smaller with the cholesterol. So with the high blood pressure, that means there's more pressure. It's harder for the blood to go through your veins, and that's why it's higher. Your low blood pressure, if it's just flowing through there pretty easily. So in order to get the blood to flow easier, gonna promote the excretion of sodium, which is salt, and the water from the body, which is a diuretic. So the diuretics, or a lot of times people will call it a water pill. If you guys have ever heard that, I take a water pill. It means it's a diuretic. So if you're taking a water pill, it leads to a decrease in the fluid in your tissues, in your body, which leads to the decrease in blood pressure, but also leads to an increase of urination, okay? Because your body's trying to get rid of all of that extra fluid, and so you tend to use the bathroom a lot more. I had one patient that was on this, and I'm not exaggerating, I think he got up 10 times in 40 minutes. It was hard to get anything done because he kept getting up to go to the bathroom. So, and I felt bad for him because he was so embarrassed about it that you could just start to get antsy. I'm go to the bathroom. So anyway, okay, so side effects of this, if you're getting rid of all the fluid in your body, you're gonna have a dry mouth. Okay, orthostatic hypotension, who remembers what that is? Do you remember from clinic? Is the word at least familiar?
Yeah.
Okay, it's if you're laying down and you sit up too fast, you pass out. Okay, so the blood doesn't get back up to your head because you're laying down and it's throughout your whole body, and then you sit up, all of a sudden it just goes right out of your head. So that's why, and then they can pass out. So hydrochlorothiazide, so these ones, so hydro is water, just think of that. The loop diuretics, also know those ones, Lasix. Okay. Okay, beta blockers. These ones are the I call them LOL drugs. OLOL. Yeah, that's right too. So they're going to reduce the blood pressure by decreasing the cardiac output. So they're going to slow your heart down a little bit. These ones you definitely want to avoid epi with the non-selective beta blockers. So that's why we just always go back to Lexicomp and look up Lexicomp to see what they say. I don't have everything memorized to know which drugs do what. So I mean, even still to this day, I rely on Lexicomp to make sure that it's there. When you get out and practice, if your dentist doesn't have that, I would really encourage him to get something like that to look up the medications easily. Otherwise, you're flipping through a book. Exactly. So a lot of these, the Inderal, propranolol, those ones are pretty common. Low pressure, that one's very common. I've seen that one quite a bit. For the test, I'm pretty sure you need to know which one is non-selective. Know if it's non-selective or selective. Okay, so calcium channel blockers. These are going to reduce the blood pressure by causing systemic vasodilation. So throughout your whole body, the vessels are going to open up. They're going to get bigger throughout your entire body, not just in one area, but through the whole body. It can be used to treat several things. The side effect of this is gingival enlargement and xerostomia. I will almost guarantee there will be a question on boards about what drug causes gingival enlargement. Calcium channel blockers. Okay, that will be on there for sure. Most common ones, Procardia and the Norvasc are the ones that I see the most often. Okay, so the ACE inhibitors, these are also called Pril medications. Did you guys know there's a Pril soap? I didn't either, but I just typed Pril into Google and there was. Try to get a visual. Okay, so the ACE inhibitors are going to block the production of angiotensin II. I don't know what that is. It's a hormone of some kind. And then again, that's resulting in the vasodilation. One of the biggest side effects is altered taste, or dysgeusia. How do you say that? Dysgeusia? I don't know how to say that. Orthostatic hypertension and a dry cough. There is this guy that I know, he's just a family friend, and I feel like he is always just has this dry cough. And when I was doing this, I'm like, I want to ask him if he takes an ACE inhibitor, just out of curiosity. Lisinopril is a very, very common one. You guys will see that one pretty often. Lisinopril is a really common, but just make sure you know the Pril. So again, this one, you'll need, that's another suffix or suffix that you need to know. Is that the last? Yeah.